Wait, I'll start the broadcast.
Oh yeah, the broadcast. Yeah.
The broadcast is now starting. All attendees are in listen-only mode.
Well, thank you, and I want to welcome everyone to the June 2020 meeting of the Poverty and Homelessness Board. When we get to public comment, be sure for those in the public that want to speak to hit your virtual button to raise your hand, and we'll go from there. Let's begin with our introductions. I'll go first. We'll just try to do this quickly. I'm Pat Walsh. I'm with Vox Public Relations. Sean?
Sean Van Gordon, Springfield City Council.
Lucy Venice, Mayor of Eugene.
Paul Solomon, Executive Director at Sponsors.
Steve Manella, Human Services Manager for Lane County.
Cliff Harold, Sheriff.
Noreen Dennels with United Way.
Sean Murphy, Laurel Hill Center.
Great. Welcome.
Amanda Cobb, Children's Community Health Plan.
Welcome.
Jacob Fox with Homes for Good is on.
Chris and Pat, are you there?
Dave Haverland with the Department of Veterans Affairs.
Hi, Dave.
Rick Kincaid.
Welcome, Rick.
Susan Lopez.
Chris McAllister.
Hey, Chris.
Hey, Pat.
Anybody else there? I don't know.
Ashley Espinosa, Lane Workforce Partnership.
Oh, hi, Ashley.
Hello.
This is Adria Godin-Finan with Pacific Source, and I'm sitting in for Brian Lang.
Welcome.
Thank you.
Commissioner Farr, are you with us?
I am, Chair Walsh. Thank you. This is Pat Farr, Board of County Commissioners on audio.
Okay. Amanda, did I hear Amanda? Is Amanda Cobb there?
Yes, Amanda Cobb from Children's Community Health Plan.
Oh, yeah, great. Hi. Okay. Anyone else? Awkward. If not, let's move forward. I assume everybody's had a chance to take a look at the agenda. Are there any additions that we need to make to that? Changes you want? If not, I'm going to follow up on the previous meeting and the consent agenda. We need to approve the minutes and then accept the statement of revenue and expenditures as of May 31st, 2020. Any questions or entertain a motion?
So moved.
Second. A second. Is there a second from anybody?
Yes, I'll second it. Lucy.
Okay, all in favor? Say aye.
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 Anybody opposed? No. Well, great. Well, that passes. I guess what we're going to do now is move into, thank you, everyone. We're going to move now into our COVID response resources and activities. Steve Manella.
All right. So what I'm going to talk about are some of the resources that are available to us and some of what we are working on. As you all know, a portion of what has been happening in relationship to COVID-19 has been the activities of the Lane County Eugene and Springfield, each of their EOCs, and the coordination between those bodies and working on with unhoused folks. And so we'll talk about that some more. But what I'm going to talk about now is we're entering the recovery phase. And for Lane County, I am tasked with putting together the social service recovery plan. And so part of what I'm going to go through are some of the resources that are available to us. So the Lane County received a little under $930,000 from from the state of Oregon for rent relief. And that was made available as of the end of last week. We closed the process for application, and we received 1,295 completed pre-applications. We're anticipating out of that initial money that there will be enough money there to serve 400 to 450 households. And we've told the people who have been pre-screened that we will continue to be in contact with them. We have had the providers who are working on this receive information and continue to work on their eligibility. Additionally, and I don't know, Alex, you're sort of driving this worksheet, but Lane County, we were awarded close to $6 million in CARES Act, CARES Recovery Fund, rental assistance. So yeah, that's the $5.7 million. And we are working with Homes for Good, with our community service centers, Catholic Community Services, Community Sharing, Sayusla Outreach Center, and Central Latino and Shelter Care and St. Vincent de Paul on a plan for deploying those additional resources. What we anticipate is those dollars are going to be available between July and December 30. They have to be spent out by December 30. And in the next week or two, we're putting together our plan for efficiently getting those resources out. And we will reopen the pre-application on the website as soon as we have a consensus among our service delivery partners and the Housing Authority how we're going to approach going forward. So that's a lot of activity around rental relief. As you know, the state of Oregon moratorium ends at the end of this month, and the legislature is meeting on the 24th. And one of the items they're taking up is around the moratorium to put some things into legislation that the governor wasn't able to do with an executive order. There's also a federal moratorium for federally financed housing that is in effect through the end of July. Anyhow, we're trying to anticipate, how many households are impacted, how many rental owners are impacted. Those are hard numbers to get to. There are some numbers that statewide associations have come up with, but we don't have a hard and fast number for Lane County. We just know generally that the need for rental relief, given the current economic impacts of COVID-19 and some of the health impacts, far exceeds the resources we have available. So the next one I want to talk about is the emergency solutions grant. And I'm sorry for skipping around, but there's a reason why I'm doing that. So we've been allocated the first round of emergency solutions grant. The state received 6.7 million and we received 986,123. Those funds can be used for, again, for rent assistance, for homeless prevention, and for rapid rehousing, for things like outreach and for shelter. And again, there needs to be sort of a nexus with the impacts of COVID-19. And then this last week, the state got their second wave of funding. So the second wave of funding at the state level is 49 million. And we anticipate getting another 6.7 million in the second wave of this funding. There's also been legislation as part of the what they're talking about at the federal level for the next federal bill of putting $100 billion into this program for rental relief. Again, looking at the impact of the ending of these moratoriums and the fact that that it's going to take a while for unemployment to recede. So a lot of resources coming in that way. We're going to talk some more in the next item about the community services block grant, which is a flexible block grant that we get for anti-poverty dollars, and we have 792 available over a 2-year period. We also have a WIOA grant through Lane Workforce Partnership for providing, it's specifically for providing humanitarian assistance to folks that have been impacted, and specifically we're in the process of hiring. There'll be 2 teams of 4 over a year period of outreach workers to provide humanitarian assistance to persons without homes. And then another piece of this, which will be coming later, is some efforts around increasing the activities to work with people who have lost their jobs and assisting them with employment and training activities. So there's more to come on that. That's probably, for now what I want to talk about. I also wanted to mention that we have been coordinating with staff at the City of Eugene and Springfield around the potentials for partnering around allocation of community development block grant funds. There are also community development block grant funds that are going to be available through Business Oregon for the balance of the county to apply for in support of the small cities, for rent assistance, for economic development activities. So with that, I'll just stop there and take any questions that people have on any of those items.
Mayor Venice.
Yeah, sorry, Steve, I got a little lost in the weeds there. It was a lot of information. So I just want to ask this final thing within the dislocated worker grant, there's funds for outreach teams. Is that what you said?
Well, what it is it's specifically, the grant is for disaster recovery, and the disaster we're dealing with is COVID-19, and the impacted parties are the unhoused. So we're adding 2 teams of 4 during this next year of outreach folks, and 1 peer support specialist teamed up with a community service worker, and that is going to be coordinated. Something in the county budget process, we added a position for coordinated outreach to coordinate all the outreach activities, in the county. That was part of the TAC recommendations, and so that was approved as part of the county process. So these people will report to that position, and they coordinate with, our staff coordinates with Peter and the City of Eugene's efforts, and with the City of Springfield's efforts, and with Laurel Hill and Whitebird and the other groups, Looking Glass and the other groups that are doing outreach. And again, the idea in the TAC report was to have coordinated outreach so that people are being targeted. We've also applied, the county's also applied for an impact grant and we're looking forward to getting resources to add a team of mental health specialists to do outreach as well.
So Stephen, maybe you got another question.
Yeah, so I just wanted to clarify. So the city has established a street outreach coordinator.
Right.
That was part of our, I'm understanding that was part of our commitment around the TAC implementation. So there will be a separate coordinator for the county that will be working with our coordinator. Is that how that works?
Well, the city of Eugene never took on the task of coordination of outreach. What the city took on was a pilot program specifically to do outreach as a pilot within Eugene.
No, but we have okay.
And so the TAC recommendation has always talked about somebody at a regional level coordinating all the outreach between all the specialty outreaches. And so that's the piece that was added in the county budget process. So if the city continues to have their own teams and a coordinator, that person will coordinate with that effort. That's also the other piece that person will do is the case conferencing, coordinated case conferencing between all the agencies. And that was part of the TAC recommendation as well. So that if a particular organization already has a relationship with an individual, a team of people can figure out how to best serve that individual.
Steve, can I just ask a question? So with these funds that'll be distributed to nonprofit agencies doing the work on the ground, is this a reimbursement mechanism? So they have to actually provide the care and then get reimbursed? And I'm asking you because there are a lot of these organizations already that are struggling. And so
which are you talking about, the rental assistance funding?
Not actually all of it.
Yeah.
But mostly
it depends on the programs, but like with the rental assistance program, we can request draws and get money out for cash flow to the organizations that are working on those programs. Some of the funding is more restrictive in terms of it is, some of the funding ends up having to be cost reimbursement. And so the other thing that we've had a discussion about internally at the county is how we can do advances, because there's a potential, we take a risk, but there's a potential we could advance our own funds and then replenish them. And so we're looking at tactics like that.
Honestly, I think that's really great to hear that, because I do think in conversations that we've had with some of the nonprofits, they're struggling and it's not going to get better. So anything the county can do in terms of advancing those funds and getting reimbursed would, I think, be just would be a good decision and a good gesture, because again, I think some of these organizations that we know they're struggling to just continue day to day.
Right.
Pat, I've got a question. It's Paul.
Go ahead.
Steve, so with some of this funding, I'm not really clear on whether these allocations are in addition to what we normally get, like for CDBG and ESG. Is this additional money?
All of these allocations are related to COVID-19. So all of these are in addition to the resources we get. And so, I'm anticipating, for example, our budget is a little north of $20 million a year. And I'm anticipating that by the time we see the next legislation, that we could have between 15 and $20 million of additional resource. But that's some of these resources we can spend over a 2-year period. The rental relief money, that's part of the COVID relief fund, it's federal money, and the state has to have it spent out by December 30th unless something's changed in the legislation that gives them more flexibility in the next bill that's passed by Congress. It all has to be spent out by the end of the year.
Sean?
So Steve, looking through this, it's sort of presented in a way that is like, here's the source of funds, here's the money, here's kind of what we're doing with them. Is there another view that's available to try to get that is sort of like the opposite way of like, what are all the things that we're doing, and then maybe how they're getting paid for? Because I'm having a hard time sort of seeing what the actual county strategy is here. I know it's there, right?
Well, yes, we can do that. And what I would say is most of the money we have been awarded, but we have not received. And it's sort of similar to like the discussions that you're having in Springfield about the community development block grant. They're like with some of these programs, we need to determine what the strategies are going to be that we're going to fund, and what that looks like. But we can certainly, as we lay out the strategies, we can certainly provide that information to you.
And the other, I guess, concern from a overall regional jurisdiction is like getting the coordination piece, right? Like just the amount of funds makes this a complicated system, and I don't feel like we have a really good handle on sort of like whose move it is on the dance floor, right? Like, and just it's going to take a couple of iterations, but like just to smooth that process out would always be helpful.
Yes, I agree.
Can I jump in? I just follow on Sean's comments, which were my own thoughts too, which is it's a little bit dizzying and hard to kind of figure out how this relates to what we're doing. And I guess the other question I have, and maybe as you develop the strategy, that'll be clearer. This is a huge amount of money, and that's really, really great. I mean, we have a lot of needs and there's a lot of funds coming in, and that's great. And my question is around our sort of, there's the immediate need of, how we help people this year, knowing how things are in our county, we have long-term needs. And so I guess I'm going to be really interested in seeing how this strategy of infusion, this huge infusion of funds in a short time period, might actually help us sustainable capacity. Otherwise, I think it's challenging for providers to have a big infusion of money to support staffing and operations that then goes away a year later when, so how do you staff out? How do you have that be sustainable? And I don't know how much that's sort of factored into these kind of larger grants.
Yeah, I will tell you from my experience, having worked and programmed money through various recessions, additional federal money, is typically what happens is that you have about 2 federal fiscal years, depending upon the length of the recession, of the infusion of additional dollars, and then the money goes away once unemployment goes down and once people are back to work. So I think that part of what we have to look at is, it's just like when we do our county or city budgets and looking what is ongoing operations, what is one time. And then the other thing that we've talked a lot about when this was presented at the Human Services Commission is, are there opportunities to leverage some things in the short term that are going to help us build capacity in the long term? For example, if we can fund something, that we had on our list that we needed to fund for a couple of years, does that give us an opportunity to give people the confidence in that strategy in order to find different funding in the future to support those activities?
Any other questions for Steve?
And Alex, you're making available this updated list in the chat box, or how are people getting this?
This is in the board packet, and it is it's all one PDF in the handout section.
Okay, thank you.
Great. Well, thank you very much. Thanks, Steve. I think that we're all interested to see how this money is, how the strategy works to distribute this money, and that we can hit some long-term opportunities while we have the time. So thanks very much.
Yeah, the other thing I just want to say briefly is that these things we're going to be bringing back to you, for your approval as we put together those plans and getting some public comment on them.
Great. Thanks, Steve. Next up is our Alex and Lynn to talk about the Community Service Block Grant COVID-19 funding discussion. So take it away, Alex and Lynn.
All right, thank you. So as Steve already talked about, we will be receiving an allocation of Community Service Block Grant funds that is COVID-19 specific. So this is in addition to Community Service Block Grant funds that we currently receive. And traditionally, these funds are used for basic needs assistance, so funding community service centers and our anti-poverty programs. So I'm going to show you, let's see, I'll get to it. In order to process this additional funding, we need to update our community needs assessment, because the way we spend Community Service Block Grant dollars is based on our community needs assessment process. And so we have to update this based on the emerging needs that we are seeing after COVID-19. And this must be approved by the board today, and then we'll have people sign it. So I'm just going to go through. This is our updated needs assessment. It's in your meeting packet for you to view in entirety. So we have described what we're seeing with COVID-19 tests. This was it's a little outdated because we originally sent this to the state 2 weeks ago, and by now we have more COVID-19 tests. But in general, the information is the same, with our historic rise in unemployment insurance claims. Lane County's Department of Human Services saw a 62% increase in self-sufficiency program applications at the start of the COVID-19 pandemic. So more people exponentially are applying for TANF, food stamps, and emergency childcare services. Meanwhile, something that's interesting is that the statewide child welfare hotline has seen a 25% decrease in calls from February to March, and it's presumed that this is due to school closure, with less opportunity for mandated reporters and community members to interact with families. So while we have this crisis going on, there's less child abuse being reported, but also families are strained. So we do hear anecdotally from providers such as Relief Nursery about the strain that's going on in families, and people understand, anecdotally at least, the strain on families, especially with having to provide childcare and homeschooling in addition to the economic uncertainty. Let's see. Our community service centers and providers that Lane County funds were sent a survey to ask them, here, what are you seeing and what are the needs to, and this was used to inform the update of our community needs assessment. In general, people said that the top need was rental assistance, and thankfully we are receiving funds that Steve already talked about for emergency rental assistance from the state of Oregon, as well as from the Federal CARES Act to address the rental assistance needed to prevent evictions and homelessness. And community service centers also report seeing an influx of new people contacting them for assistance. So these are people who've never reached out for help before, but they are impacted by COVID-19 and now they need help. So people who are new to our system, we've never seen them before. And providers are dealing with an influx of demand for many new people, and it's creating capacity issues. So our top needs identified are, of course, emergency rental assistance. Emergency rental assistance, which we plan to address with the state coronavirus rental relief program funds. And the second need identified was utility payment assistance. So that goes hand in hand with homelessness prevention and keeping people in their homes. And we have received LIHEAP, Low Income Home Energy Assistance Program, an additional allocation on top of our regular allocation to assist people with utility payments. And then the third highest need identified in our provider survey, as well as looking at the information available to us, was emergency food and the need for more food, in particular meals to be home delivered. And then in general, the need we are seeing is for basic needs assistance. As I said, the service providers are seeing more people coming in, needing help. That's an increase in the volume of people needing help and asking questions, making calls, while the providers at this time have limited ability to staff up to meet that increased demand. So providers need additional dollars for staff time, as well as additional direct service dollars to help people and get those dollars out the door. And
Okay.
is Lynn on the call? Are there any questions so far? I'm going to show you the proposed. Sorry, I'm trying to do many things at once.
So what you need, Alex, today is you need for them to approve the amended needs assessment. And then we're
Yes.
going to come back next month with an allocation plan. But this is just a draft of a allocation plan and for your feedback. And again, we're wanting to coordinate this with the discussion with the City of Eugene and Springfield and what we do with the balance of state community development block grant dollars and programming them.
But Steve, you need us to vote on this today. Is that right?
Just on the needs assessment, not on the allocation. That's all
Right.
I'm clarifying.
Okay.
Yeah.
I move that we approve the needs assessment data that Alex just covered.
Second.
Okay. All in favor?
Aye. Aye.
Aye. Aye.
Anybody opposed? All right. So that passes. Thank you, everybody. Thank you, Alex.
You're welcome. And this, what you have on the screen is just an example. It's just a draft. We don't have our funding strategy entirely nailed down.
Right. So we'll see that next month. Or
Do you want to explain how this is laid out, how where this got developed from?
Yes. So this is, first of all, we have our community service block grant funding allocation, which we know will be $792,000 over 2 years. So we want to be strategic about how we spend it because we have 2 years to spend it. And then coupled with the Lane County Budget Committee, 90,000 that was allocated for basic needs and other services. And one of the key components of the needs assessment, of course, was more direct assistance needed for to help people with anti-poverty programs, food boxes. So basically any needs that were pre-existing, pre-COVID, they are exacerbated now due to the economic and health concerns of COVID. So what we're looking at is how to spread community service block grant funds out amongst our community service centers. So these contracts are currently held by, for example, in South Lane County, Community Sharing, West Lane County, Siuslaw Outreach Services, East Lane and Central Lane, this is Catholic Community Services. And then food purchases and distribution, that's Food for Lane County. So we know that Food for Lane County, for example, has had to purchase more fresh and healthy food to supplement the shelf-stable food that they're receiving and their loss of donations. So this is meant to help with that.
Okay. Great.
Thank you.
Any questions? If not, thanks, Alex, for the information. And we'll look forward to seeing more next month for sure. Right now, Jennifer Webster from Live Healthy Lane is going to join us. Does somebody have a question for Alex? I'm sorry.
Yeah, sorry, this is Susan Lopez. I just was wondering, Alex, if we had looked at disproportionality of impact on our communities of color or our marginalized communities in this assessment, and especially now with what's going on, I just want to make sure that that's forefront of our thinking as well.
Yes, that's a really good question. So the way that we are approaching that, first of all, regionally, we are looking to provide more direct service dollars to our community service centers that are regional. And I'm going to try and pull back up the Excel. Here we go. And one of the things we're looking at, for example, for our rent relief program, we've funded Centro Latino Americano as a front door to help people get rent assistance that's in a culturally specific way and bilingual, especially because Latinos are testing, have a disproportionate impact regarding COVID-19. And then one of the things we're looking at is a new program that would serve rural Latinos, and that would be expanding our current capacity.
Okay.
Alex, is there anything for mental health or people who are trying to get into recovery, but there's waiting lists and not openings due to COVID?
We don't traditionally use DSBT for healthcare.
Even if it's the shelter needs while waiting for those specified needs and their possible risk is increased?
If I could address that, Chris, I think that is something that we need to look at in terms of the overall strategies for the overall dollars that we have available, and potentially look at that under the emergency solutions grant dollars that we're getting. And then there are also dollars that Lane County is that are available through the state of Oregon CARES funds that are coming to behavioral health that we could get you more information on, but they don't come through our division. But we just applied for a impacts grant, and Paul Solomon was involved with that. Specifically to bolster the mental health outreach, and a lot of the target population that we're talking about providing services to are folks who are unhoused with mental illness. And Paul, I don't know if you want to say something about the impact grant.
Sure. The impact grant really focuses on individuals who are homeless and are high utilizers of jail beds or the state hospital system. So it's pretty narrowly defined to really look at reducing the incidence of entry into the criminal justice system or into the state hospital system. The grant that we applied for was about $1 million. There was $10 million in total. I believe about 8 million of that's going out to counties. So it's a pretty competitive process. The county submitted an application for $1 million to provide the services that Steve described. It is a very meaningful allocation, but a drop in the bucket in terms of the need for this population. So I echo Chris's concerns about the need to continue to find additional resources for this population.
Okay. Anything else, Steve or Alex or members of the board?
No.
No. Okay. Well, thanks. I'm glad to hear that Paul, you guys are, and with the county, are applying for that money as well. I think that's going to be important, and certainly mental health is a personal concern of mine for sure for our community. Anyway, Jennifer Webster from Live Healthy Lane County is with us to talk about the 2020-2024 Community Health Plan priority areas. Jennifer?
Hi, thanks. Thanks for having me. So I'm Jennifer Webster. I'm an epidemiologist with Lane County Public Health, and I'm here today to share some of our progress on developing our next community health improvement plan. Next slide, please. So today I'm just going to go over a really brief overview of the process of developing the community health improvement plan, a brief summary of our findings, and then I really want to turn it over to you all to discuss how we can prioritize in one of our strategic issues that we have identified. So next slide, please. So every 5 years, there are several agencies in Lane County that are responsible for conducting an assessment and writing a strategic plan for improving the community's health. And we collaborate on this through a structure known as Live Healthy Lane. So from mid-2018 to late 2019, we conducted 5 assessments. And next slide, please. And these were the themes that emerged from those. So a significant proportion of Lane County residents lack access to many of the key social determinants of health. There are significant disparities in both health outcomes and in access to social determinants of health, both by geography and by race ethnicity. There is a concerning trend of worsening mental health among Lane County residents, especially youth. And the above conditions stem from and contribute to social and environmental conditions that are detrimental to healthy behaviors and healthy outcomes for Lane County. Next slide, please. And you can find the reports for all of these assessments in great detail on the Live Healthy Lane website. That's livehealthylane.org. And also, if you want to provide feedback on those assessments, there's a survey posted there that you can respond to. Next slide, please. I'm going to skip this one just in the interest of time. So today, we're asking you to look at one of the strategic issues that we pre-selected for you and how we should prioritize our efforts to address those issues. So these were the 3 strategic issues that we identified after doing a root cause analysis on the 4 themes that I just spoke of. And so we want to look at how do we ensure all people in Lane County have resources they need to live a healthy life? How do we create community conditions that support mental wellness and healthy behaviors for all Lane County residents? And how do we ensure that Lane County is a place where resources are distributed equitably? Next slide, please. So for today, what we're going to ask you to do is we're going to look at the first strategic issue. And I would like for you all to tell me what 2 areas that we should prioritize over the next 5 years to really significantly move the needle on this issue. So next slide, please. The strategic issue that we pre-selected for you is how do we ensure all people in Lane County have the resources they need to live a healthy life? The bullet points on this slide represent some of the root causes that we identified that contribute to this strategic issue. So you can select some of these root causes if you think that's the top priority, or if you think there's something that we might have missed in our analysis that you think would really move the needle significantly in the next 5 years. You're free to share that. And I'm gonna stop talking now and just listen to y'all. Tell me what you think the 2 things we need to do in the next 5 years to really move the needle on this.
Anybody want to kick us off? No.
Well, I'll kick it off.
Go ahead, Mayor.
I guess, you know, this is kind of the essential issue that we talk about in this committee month in and month out is housing and housing as healthcare. I mean, I think that, you know, we have a strategic plan that talks about the number of housing units we need to create. We talk about shelter. It feels to me that housing continues to be the sort of most elemental priority over which the county has some control. It seems to me that there are other pieces that the county has control over, but the dollars aren't really there. So I guess I would, I mean, people can afford housing if they have, it's all interconnected, but if you have to pick one, to me that housing is the place you start.
I think housing, I mean, to me, I think there's there's something missing on here, and that's jobs. I think jobs are pretty critical to obviously to wages and healthcare and all those other things. I think to me, jobs are after housing and healthcare are pretty close to the top of the list. So.
If I may add on to that, those 2 comments, jobs for people who are traditionally not being hired right now because of their past. Jobs for people who have developmental disabilities that are keeping them out of housing. A fixed income housing. We talk about housing, but we see a lot of the big projects be for people who can afford large down payments and things like that. We need to be able to acknowledge how many people in our community are underneath the poverty line, whether it's rural or urban, and housing options and job options that allow those people to stay in their communities. A felony 30 years ago should not be stopping you getting a job today, but it still does. And being honest about being in recovery has lost more people their jobs than has gained them.
And I would just echo that, what Chris just said. And the other part of this is jobs are important, but living wage jobs, as we just got the Alice data this week, and this is pre-COVID, so 2018 data that tells us that 45% of Lane County households are just barely hanging on, and it's because of housing. Housing and childcare are the 2 greatest expenses for a family. So I'm happy to send out that link to the current data, and that families of color, people of color, have even more disparity in inequity. So you know, it's just I'm going to be quiet because I've had a chance to participate in a couple of these other assessments and feedback. So I'm going to be quiet now. Try.
John.
Chair Walsh, can I get in the queue, please?
Yes, absolutely.
Thank you.
Pat, did you call on me?
Yes.
Go ahead.
This is Pat Farr. Am I in the queue right now?
Sure, go ahead, Pat.
Thank you. I'll be very brief because we do have an opportunity to weigh in also. I think always the overarching issue is surrounding housing and putting people into permanent housing. But under that, of course, jobs and economic development are significant. Behavioral health issues are significant, and always adequate nutrition and food.
Very good. All right. Sean Van Gordon and then John Fox, did you want in? Go ahead,
So-
Sean.
Yeah, I was just going to echo the low barrier housing, not just housing, but low barrier. That just seems to be such a keyhole entryway to stabilizing. First thing of reestablishing yourself from homelessness is low barrier housing.
Councilman
Okay.
Baker.
So I guess I would echo the jobs category, but one of the challenging things I think we face is I don't think services around this are coordinated nearly enough to be able to make an effect, to make us make effective progress on that, right? So, I think all the issues that we related are all good, but like the thing that's really preventing us from doing that is the whole system between governments and nonprofits is so siloed, right, that we can't effectively move the dial. And like the example I always think about is, hey, we'll all say that keeping people at work, keeping people employed, is important to their livelihood, but like it's like, well, have we built the county health structure around that they can, that they can have access to get checkups after hours, right? Like I don't know the answer to that question, but that's a coordination piece that says, hey, look, we can both do healthcare and make sure that you're not having to leave work early at the same time. I think we've got a huge complicated system here, and we never really have the conversation that says the model we built and how we deliver services is probably 20 years old, and we're not thinking how do we get to the place where we need to work it in the future, and jobs.
Anyone else want to weigh in on this one?
I'll like to weigh in a little bit. It's Ashley Espinoza here. I would say how we support our youth. I think that the way that we are, we, at least here in Lane County, we don't have a lot of, now that we're seeing that the diversity and we're seeing, we're having more diverse youth and who are our teachers and who are lifting up our youth and seeing about that pipeline. And I just feel like there isn't a lot of mentorship and sponsorship for our youth and supporting our youth, and there are a lot of people that are falling through the cracks. And so I feel like that there needs to be a lot more support in that way. And then also I think that there needs to be definitely what Chris was saying about the screening process of employment. I think there needs to be a really big look back at that. Because there can be so many different ways that we can look at certificates and the way that we can be doing lifetime learning, and people can qualify for a lot of jobs that they're not even being looked at, and they're being looked over and can completely do the jobs, and they're not participating in the workforce for not checking certain boxes, and it's a very frustrating situation.
Understood. Thanks, Ashley. Anyone else?
This is Rick Kincaid. Again, thank you, Jennifer, for bringing this question to this group. I've had the pleasure of getting to answer all these questions several times with Live Healthy Lane work and 100% health work that we've done with a large collaborative. All of these things are interrelated, and I think that the struggle is really, how do you prioritize? How do you, what are the things that can move things the farthest, the fastest? Because every single bullet point and many more that you could add are necessary in order to really create health within our community. And I think what our effort is to try to prioritize. So I appreciate your help in helping us to do that. And also to recognize there were two other questions on this, particularly that of around equity. And as all of us know, that means applying resources in a way that creates equity, not equality, equal application of resource. So how we effectively move in that work also influences each one of these bullet points. So just all the information that we're collecting, our hope is that we can get down to some key strategies strategies and some key collaborative work that we can do in a collective impact model to try to move this work forward. So again, I just appreciate your input into this process.
Thanks, Rick. Very helpful. Anyone else? Jennifer, what's next?
So if you want to advance to the next slide. So we're conducting these kinds of conversations with several groups around all of the strategic issues that we identified, and we'll be compiling those and trying to come up with some priorities. And then we will probably take those back out to the community as well as we construct a plan for 2020. Well, it's more likely 2021 to 2025 at this point. But so hopefully we'll come back to you in a month or two with some priorities just to kind of ground check to make sure we're on track.
Excellent. Is this email address down here, how would you like us, if we've got other thoughts, how would you like us to get those to you?
You can email Senna. She's our coordinator, and that's her email address on the screen. You can also, if you go to the Live Healthy Lane website and you want to review any of the assessment data or other documents, there's a survey there that you can do. That's a really quick way to give feedback. Either way, it's great.
Okay. Well, great. Thank you very much for bringing these to us. Go ahead.
Yeah, thanks so much for having me.
Right. Anything else? Okay. If not, let's move on to our committee updates. Thank you. Membership committee. Alex?
Is Sean Murphy on?
Sean?
Yes, I am here.
Oh, good. Membership committee update?
Yes. Hold it. You caught me not ready. I'm got there.
Sorry.
No, my bad. So we.
Let me pull it up too.
Okay.
'Cause it's kind of.
Yeah. So we have met a couple of times. We've done some interviewing, and we had a couple of requests or things for the Poverty and Homelessness Board to consider. The former homeless youth representative, that one is still open. We had a few applicants, but we weren't able to get to connect with them to actually get the interviews. And so Chris is going to do some outreach to the one individual to see if we can reconnect to try to schedule an interview. Let me see. Christine London from Looking Glass applied. Oh, wait a minute. Oh, so we're going to continue to seek a youth representative. So I'm sorry. So one of the things that we discussed about and some concern that we had about the homeless, having a voice for the homeless youth on the committee is that we really struggled to fill that position. Mm-hmm. And it's been vacant now since February. Mm-hmm. And we've had 3 previous individuals who've had to resign because they've had schedule conflicts or other life issues that were occurring. And so we were recommending that the board consider adding a homeless youth representative member, and Christine London from Looking Glass, who applied for the victim services position, that if we could have, in the absence of not having an actual person with lived experience, someone who actually works directly with individuals, the youth with lived experience, to fill that position. while we continue to look, because at this point, we've gone a long time without having a consistent voice from the youth represented on the committee.
Sean, is the youth representative, does it just come down to scheduling and transportation, or what are the, I guess you listed some hurdles, but is there anything that's consistent with all of the candidates we've had that have had to move on, or?
So I'm gonna let Alex give you the specifics, because she's worked a lot closer with talking to the representatives as to why they had to move on.
Sure. I'm just trying to look for a common thread if there's a way to anticipate this with future candidates and how to solve it is all.
It has been difficult to get people to engage youth to apply for this position, even though this position we offer a stipend for participation for the youth representative. Right. The past 3 members have resigned due to work schedule conflicts. And in particular, their work schedules have really varied besides the 9 to 5, but certainly attending a PHB meeting from noon to 1, they couldn't do that with their schedules.
Understood. I know it was the middle of the night for a couple folks, I mean, given their hours they work, late nights and early mornings and things. Okay.
Just to clarify, what the membership committee discussed is that while we have this vacancy for homeless youth, we also had multiple victim service representative applicants, and one of them was Kirsten London from Looking Glass. And so if she's willing to serve, and this is what the membership committee proposes as an idea, but it would require a change to the governance charter, because we have a membership representation set aside for someone with lived experience who is a youth. And we could change the governance charter to say, in the absence of being able to recruit a youth, we can have a representative who does not have lived experience. But that is quite the change.
It would be. Okay.
Chair Walsh, this is Pat Farr. I have a comment, if I may.
Yes, please.
I think, thank you. And I think particularly somebody from Looking Glass who actually represents the interests of youth would fit that position well in the absence of youth in general. So I think if we were to add just a small line to the governance charter to state someone representing youth who's not a youth in the absence of the availability of youth may work out well.
Okay. Any other thoughts?
Well, this is Paul. What are we doing in terms of recruitment aside from offering a stipend? I guess I'm not really clear on what the recruitment efforts look like. And it seems like we might want to continue to recruit people, to keep people in the pipeline, given the high turnover that we've had in this position.
Good point.
Yes, we send the vacancy out to youth serving providers, and that includes Looking Glass, St. Vincent de Paul's Youth House. 15th night, we spread the word, tell people we're looking for youth, and this is a leadership opportunity. Staff are available to answer youth questions, and we have heard from some people. Some youth have asked me for more information about the board, but then very few apply or make it to an actual interview.
Yeah, Alex, I wonder about the potential opportunity to have a designated youth and an alternate and a second alternate, and whether if we had someone like Kirsten London be in the role of a sort of a mentor, so that the smaller group of youth are encouraged to create a little cohort among themselves and maybe have the capacity to take turns and to work with an adult leader who sort of encourages them to participate or help. I mean, I just wonder if there's a way in which we need to cultivate these young people to do this, and they're grappling with a lot of different demands on their times and challenges, and they get jobs where they can't be available at noon. And so I wonder if we actually look at sort of changing our directive around this if we want to embrace it in a slightly different way that might accommodate and kind of help them develop that leadership training without having them, it's all the initiatives all on them. They got to step up and do this. They got to do it. I mean, I'm just wondering if there's a way to support it better.
I want to say, when we talked about this, one of the things that we said, the models that we looked at was Chris McAllister and all the work that he's been doing with the unhoused, and actually some youth that are unhoused. But we don't have a position and a person who can always come back and represent their voice as they're meeting as groups outside at times and days and things that suit their needs. And so part of what we thought about this representative was that there would be a group of youth, and we would still cultivate youth being involved and having subcommittees and specifically for youth. But if the time and the dates weren't working out for them, that there would be somebody that was working with them to actually bring the information from those groups specifically around the youth experience to the committee.
I believe Deborah Daly has something to add, Chair.
Okay, good. Please.
So in response to having Lucy's idea, which I love these ideas, I feel like, you know, that would be just an additional responsibility for a youth that is trying to navigate all these systems and work and have children and find housing. You know, like it's a good idea to pair up, but I think it would be an additional stress. As far as the Youth Action Council, we've reached out many times. We've gone to the youth house to speak to the girls and ask if any of those girls are interested. It's been an effort from the team, the homeless youth team, to find a youth. And you know, they're very interested, but it's a lot to ask of them. And I don't know how to make it easier. I think you know, it should, I like the idea of having a representative from, you know, Looking Glass or someone that's working with youth all the time. But I also think it should always be open to a youth who whenever and whomever we can, you know, have come on board. And we could have two representatives if we could find them, but I don't think we should ask them to work together. I just think it's just another, you know, thing. I just think of the last person we had join the poverty and homeless board. And, you know, I happened to be at an apartment house and she came out and, you know, it was like, I can't do this. You know, I'm going to have another child. I have my young person. We're trying to do, I mean, I have another, it was just way too much. So I'm not sure how to make it easier. I really don't think the money makes that kind of a difference to them, you know, that they get a stipend or even a raise in the stipend. I think they wholeheartedly want to have a voice and they believe in it, but it's just very tricky. I don't know if they could do it remotely, you know, join the meeting remotely, and that would be a way to let youth have a voice at the meeting and in our monthly meetings as the homeless youth team. So anyway, those are my thoughts. It's a big endeavor to ask a youth to come on board of something like this, and important. So.
Okay. John Fox.
So maybe the requirements could be somewhat modified, and they give quarterly attendance and just reports, or so that they're involved. We share the information, and if they have any insights or something to share, they submit a report, and then they do a remote meeting or any of the other ideas, so that the pressure isn't once a month from hour and a half during key work times.
Okay, it's a good idea.
And the the representative or the person that's the representative could be that conduit to the poverty and homeless board. So, you know, they could text them ideas, you know, like, I've just seen this happen and, you know, there should be a response to this, or, you know, some communication between those two might make it a lot easier. And then the representative will be attending our meetings and speaking on behalf of them. And that could be a simple way, you know, make sure, yeah.
Sean Van Gordon.
You'll have to excuse the noise. It's like toddler level 11 around here right now. So has anybody asked them what would make it easier for them to participate?
Yes. I believe all the conversations and all the questions have been asked. How's this? Can I drive you to the meeting? Can I, you know, yes. I would say, Sean, yes. And can we do a better job? Yes. But I think we haven't hit on what is the right format to have them participate. You know,
we're working on it. We don't have it yet.
Well, let me suggest this, perhaps, because we're getting close to the end of the meeting. Why don't we push? Sean, are you okay with taking a look at this particular position and then coming back based with your committees, with another committee recommendation based on some of the ideas you heard this afternoon?
Yes.
Okay. I think that sounds good, because there were some good things that came out for sure. Is there anything else we need to do with the committee, membership committee at this point, or anything else you want to report out?
Oh, yes, that we are still gathering applications for the business representative. We received 3 applicants for victim services. And one of the things that we requested, and as we were talking about similar with the youth representative and the unhoused, is that we would like to see a representative for both children and adults, because there's 2 different types of issues. And so we were recommending that we would like Susan Lopez, who's been doing a lot of work in the young adult and children realm, to continue as a victim representative, to continue in her position as victim representative, and to add Julie Weissman, who is with Women's Space, as a victim services representative as well, specifically around adults.
Okay. Great. And is that going to take a change with our charter or governance charter, or does it?
It doesn't require a governance charter change.
Okay. And do we need to vote on these things today, on this today?
We need a motion for that.
Okay. Yeah.
I'll make a motion that we approve both Susan, to retain Susan, and to add Julie Weissman.
Second.
All in favor? Aye.
Aye.
Anyone opposed? If not, that passed. Thank you so much, Sean, and the committee. I appreciate the work. The RFP HMIS Evaluation Committee update. Do we have one here today? Okay.
Yes, sorry, I was on mute still.
Okay.
Chris McAllister here with the updates for the REH. Our committee met in May. We discussed that the Eugene Mission is no longer participating in HMIS. They will be using a third-party software. Lane County staff are currently working with the mission as well as the software developers to successfully upload their data into our system. Our policies and procedures may need to be reviewed and updated through the committee for this process. Also, the committee also approved the 2020 Continuum of Care competition ranking and reallocation policies. The COC's evaluation process was completed this week, and all agencies have received their final scores. No formal appeals were received this year. A full report will be available at a later time.
Great, thanks, Chris. Do you want to do league too?
Yes, sir.
Chris, let's start with that.
Chair Cheryl had something to add.
Oh, sure, Cheryl.
that correct? We are continuing to participate in HMIS.
Okay.
I was not at that meeting and I was just reading my staff notes, so sorry.
All right. Thank you, Cheryl, for the clarification, and thanks, Chris, for the report. Anyone
Would you
else?
like me to go into league?
Should we go to league? Let's go to league.
Okay, our league group has continued to meet monthly. We are providing feedback on policies and procedures for the River Avenue facility, have provided input to the healthcare committee on addressing stigma in healthcare settings, and have begun providing input on MLK Commons interior, such as furniture, colors, etc. The committee will continue to discuss these items on those topics. We also will be having a second special meeting in June to discuss the COVID-19 response, and we'll be providing recommendations. League will also have an open, we continue to have an open invitation for new members. We've got a few applications. We have been really putting an emphasis on finding rural participation. And just like with the youth seat, which we will always have a youth seat available and open on our group, we reach out to the people who are not inside our city limits.
Okay. Any questions for Chris regarding league? If not, healthcare committee. Rick.
Rick Kincaid. The healthcare committee continues to meet despite COVID, and have been doing virtual meetings throughout this period of time with each of our subgroups. Primary focus in the initial portion of March and certainly April was COVID response, making sure that we had appropriate support within the sheltered environments, trying to problem solve with some of the challenges we had with patients going to and from hospitals, nursing homes, and others that had restricted access based on potential COVID and infections. So we spent a lot of time problem solving and working with Peace Health, Shelter Care, Occupy, Whitebird, everybody literally try to problem solve in the moment. Great work with the county. So we were able to do a lot of that kind of real-time work. We did get back to our care coordination and discharge planning work. We have gone live with collective medical and HMIS connection. So we're able to use the combined databases. So for health systems, hospitals, and clinics, they're able to access collective medical, which is basically an information exchange system that allows us to exchange information related to activities around a particular patient with a certain identifier. So what that does is lets us look to see whether patients have access to different parts of the resource systems, and it's really helped with a lot of our discharge planning and care coordination. So that has actually gone live last month, and so the clinics and the hospitals are already using that. It's been great work by Lisa Stewart and her team, as well as the analytic team from the county. That was extremely helpful. We have been also continuing to work with care in the sheltered environments and trying to be able to make sure that we're combining resources, particularly as the different shelters were set up for COVID, making sure that there was appropriate support. So fabulous work by Whitebird and others to provide some of those services. And then some of the transitional elements were also done. Shelter care is stepped up, and we've been able to create beds, and then the county with its new facility extremely helpful. We also are at the same time in the background continue to work with our respite care options. So as we get through COVID, then we're trying to figure out, okay, where does some of these facilities fit into that medical respite sort of portfolio, or depending on different needs. We have had access challenges because of COVID, and some of the challenges with particularly with skilled nursing, because they have a lot of restrictions, appropriately so, because of those congregated environments. So our team has been trying to problem solve again as we get through these various waves of potential virus exposures. We'll continue to process and work. So each of the teams are meeting on a monthly basis. Our big team is coming together quarterly to review those things and keep the work moving forward. But again, I appreciate the participation from all of the collaborative partners.
Thanks, Rick. That's a ton of work that's moving forward. And any questions for Rick in the Healthcare Committee at this point? Great. Thank you. Employment Committee.
Thank you, Pat. The Employment Work Group Committee met on 6/4/2020, and it was our first virtual meeting. And I thank county staff and all the members for enduring me chairing that meeting. We are on track to revisit supported employment opportunities within the catchment area, and also taking a look at social enterprise or the incubators and entrepreneurial incubators that are in the area as well. There was much discussion around COVID related unemployment, and we just hope that we can come out the other side of that. We welcomed Tiffany Edwards' participation from the Chamber of Commerce representing business. And we'll get back on track here. It had been a lengthy absence from the employment work group due to a number of circumstances.
Sure. Well understood. Thanks very much for your work, and we'll learn more here in the next few months. The Veterans Work Group. Anything you want to share? Okay, I want to thank everybody in there with all the good work you're doing with the committee. We've certainly covered a lot of ground today, but the committees are covering a lot of ground every day. So thank you very much. Let's move on to our chair elections. Alex, do you have a report?
Steve, did you want to talk about that? Oh, Steve, you're muted.
I'll speak to this. So we have a need to appoint officers, and we also are in the process of reviewing the coordination of the PHB and particularly the executive committee with how we coordinate moving forward with the implementation of some of the tax strategies. And so some of those discussions that we talked about earlier this year have been delayed because of the COVID-19 emergency. And so what we're proposing at this point, the recommendation from staff is to extend our current officers, if they're willing, for another 60 to 90 days, and to have the conversations with the Lane County and the city of Eugene and Springfield about the looking at the alignment of the PHB executive committee, and then coming back with a recommendation on moving forward.
Okay. Discussion on this?
I mean, is there a particular reason why I guess I don't understand. I mean, these conversations go on. Is there some reason why new officers can't be elected? Was there strong?
Well, I think the issue is if within 90 days or so we end up with a recommendation for a different structure and a different executive committee, it might impact who the officers might be for the board. And so the thought was, to ask, the current officers, Pat and Noreen, if they would be willing to continue to serve. And so this would be less disruptive than to bring new people on and then have a change in governance. That at least that's what the discussion has been.
Okay.
I, for one, as a member who has been participating in a lot of the committee work, almost every committee, as well as somebody who has been involved in our TAC implementation plan, do not understand why there would necessarily be a need for new members to possibly be considered on the portion of like new governance, when everybody around this table has been party to the same kind of structure we've had, and a transition to move forward would not necessarily inhibit the new stuff, in the same way that having different members and different people in different positions did not inhibit us from working on our strategic plan updates and things like that. That's just my thoughts, but I yield to the rest of the group.
I guess you have to remind me a little bit, what's on the table in terms of restructuring? Could you just bring that back?
Yeah, what we were talking about before is a lot of the decision making around resources and support for implementation of strategies for homelessness and poverty are happening within the city manager's offices in both of the cities and the county administrator's office. And currently the design that we have that's different than what they have like up north in Multnomah with the city of Portland, city of Gresham, and the and Multnomah County is that they have the executive branch of the local governments represented on their executive committee for their continuum of care, so that they have the alignment with those institutional leaders. So it's not just the elected and the appointed advisory people, but having the institutional leadership play a role in the executive committee. It would not. The other thing that's come up around the broader committee structure has been there's been a desire to see if we could eliminate we have some positions that are currently ex officio, and the people who are participating as ex officio would like to be involved as full committee members. And then the other consideration that has been under discussion is whether or not this should become a intergovernmental committee rather than a county advisory committee to the Board of Commissioners.
How long has this discussion been going on? Because it seems like we were voting on Friday and now we're hearing about applause.
Well, this was, we talked about it at I can't remember specifically the dates because it was before the pandemic, but we discussed it at a few of our PHB executive committee meetings. And
can I just jump in, Steve?
Yes, thank you.
I think it's been at least 6 months. It seemed like the conversation started late fall last year about a restructure process to be more effective in how we align the TAC report, the TAC work, and just sort of the conversation started back then. And I think it's just recently that that it made sense to sort of maybe press pause a little bit and sort of, as we figure out what that looks like, that it made sense to maybe hold off on doing anything else in terms of additional making changes in terms of the chair-elect role or chair, vice chair, whatever the second
The terms are, right?
Thank you. Does that make sense?
It does, Mr. Chair, if I may. I believe when we had that discussion late fall of last year, we had picked a conversation to happen around March and April because of the fact that we'd already be done with our point in time count. Our winter preparation would have already been wrapped up, and we'd be able to do it in enough time to be able to organize for the next year's winter strategies. I could not find reference to it in the minutes, but I was also looking for when we briefly touched on the conversation during our general meeting, which I think was shortly after that executive meeting where we discussed it.
Chris, that I believe you're right. That was the plan, and obviously we're off track for a number of reasons with things, and perhaps we should push pause and revisit the discussion. Does that make sense, or?
So Pat, I think extending the chair and vice chair for 60 to 90 days might make sense until we get like this whole restructure conversation sounds like it's kind of a mess about the timing, what's happening, all that kind of good stuff. But but at that point, we can't I think we have to make a decision. And I'm just gonna, as we bring this conversation up again, and I just want to echo the same concern that I had in the fall. My jurisdiction is not going to be there on going to an intergovernmental board. And I think talking about it's fine, hearing out what that is, but I've got some serious concerns about it. I don't know that Springfield as a whole is going to be really interested in that sort of governance structure. There might be a path to do something a little bit different, but I want to make sure we're all clear on that piece.
Understood. Thanks, Sean. And for my part, as long as there's a clear end to the conversation, that there's then a decision made. I mean, I'm for pushing pause, and it also would give some time to get the business representative on board. But if that's the best way to move forward, then I think we all ought to weigh in on that.
Yeah, I'm kind of following with Sean. Also, I think it's okay to pause. This is a kind of a bigger conversation, and there's a part of the proposal about becoming an intergovernmental body. I mean, we already have the Human Services Commission, where counselors sit on that and they have voting authority. I guess I'm not entirely convinced that is the way to go with this board. So I guess I'm with Pat. I'm grateful to Pat and Maureen if you're willing to continue in your roles for another couple of months, but I would really like an end date, and I would like to be sure that on our agenda we're actually hashing this out rather than making a vote on leadership that somehow sets us on a course on this IGA thing, which we haven't really hashed out. So.
Okay. Thank you, Mayor.
Do we have any outlines or conceptual schematics for any of the ideas?
Yeah, we presented some preliminary information, and staff will go back and we'll lay that out again, because all of the ideas are not mutually exclusive. One of the main thoughts that Noreen touched on is we're very concerned that going forward that there's coordination between what's called the TAC implementation and the work that this board does. And then, as came up in the previous discussion about all these dollars that we're allocating and what we're doing, that we have a good structure to coordinate regionally. And so the thought has been, do we need to do something different like some of the other regions are doing to make sure that it's more of a regional, and so that can be done with or without it being an intergovernmental committee, but just with that intention. So we can lay out those things, and we can have that available for the next discussion. The intention was that the chair and vice chair and staff from city and county were going to get together to discuss this prior to bringing it to the PHB, just to get the ideas of the administrators. And again, all of that work that was to occur in the spring ended up getting delayed as staff were working on things like setting up respite shelters and setting up additional outreach and sort of the COVID activities. So, and so I think you're right. We should just make a decision, in the next 60 days, whether or not it makes sense to make any change this year or to wait another year before making any kinds of changes.
Okay. What do we need to do with this? Do we need to vote on it? Do we need to just give it back to you guys? I feel bad. We've elected some people, and now we're pivoting, I guess I would say. So
Have we elected some people? I'm sorry.
We haven't elected, what we did,
we voted anyway.
we surveyed who was interested and who people thought would be a good candidates for the chair.
I misspoke, so I apologize, but
yeah,
so we surveyed as opposed to others, so.
Right.
So then, Steve, what do you want to do, I guess?
Well, my recommendation would be to follow up with our county administrator and city managers to see if there's any interest in this discussion, to bring back that at the next meeting, and then a decision could be made. And if the feeling is that this is 6 months or a year away from making any changes, then to go ahead and put the election of the officers on the agenda.
Okay. Well, good. So that gives us 30 to 60 days, maybe 90 at the onset. As I don't know, is everybody good with me? And I presume Noreen, if you're interested, sticking around for another 60 or 90 days. I mean, if I'll be able to make this thing go.
Yes, I'm fine.
I have a question.
Yeah.
We'd like you to stick around longer in general, Pat. So it's, in your current role, 60 to 90 days is good.
Thanks, Rick. Appreciate that.
I support the people in the position for 60 days maximum. I think that we have a lot of stuff that needs to move forward, and pausing when we're in the middle of very vital work is very concerning to me, but I respect the decision of this body.
I'll second that proposal. I think that 60 days should be sufficient.
I agree. Okay, so that makes sense. Do we need to vote on this? Guide me here, Steve.
Well, I think we have the direction, if that's the consensus, that we want to take care of this within the next 60 days, that's the direction that we have from the group.
Sure.
And so.
Okay. Thank you. And thank you for all that participated in the survey and in this discussion. I appreciate it. I know some of you may need to sign off because we've gone a little bit long, so feel free to do so, and we'll move to public comment. Alex, we have anybody in the queue?
No one has signed up for public comment.
Okay, well, I'm going to give everybody here a minute to hit the virtual hand raise.
There's no one in the audience who isn't a member of the board or staff.
Okay, well, with that, I'm going to adjourn the meeting. Thank you, everyone. I appreciate your time, and we'll gather next month.
Mr. Chair, someone said hello. I don't know if they wanted to say something.
Thank you.
I didn't hear it. I'm sorry.